When someone goes into cardiac arrest, their heart stops beating, which means that blood and oxygen don't reach their vital organs, including the brain, causing them to lose consciousness and stop breathing normally. This video will show you how to perform CPR, which includes compressing their heart to pump blood around the body and assist them with their breathing. This is the most important step in saving a life.
Hello, are you okay? Hello, can you hear me? Can I have some help, please? Hi, can you dial 999 and ask for the ambulance, please? This man's unconscious.
When you see someone is unresponsive, you must act as quickly as possible. Assess the scene for danger. If it is not safe for you to approach, don't. Remain in a safe location and call 999. Check for a response.
Can I have some help, please?
Shout for help. If someone comes to help you, ask them to call 999. If no one comes, call 999 yourself and put your phone on speakerphone. At this point, the call handler will ask you some questions. These will include your name, number and location, as well as asking for a brief description of what has happened. Move the patient so they are lying on the ground flat on their back. Open the airway by placing 2 fingers under the chin, a hand on the forehead and gently tilting the head back. Look, listen and feel for normal breathing by placing your ear by the patient's mouth and looking at the chest to see if it is rising, listening for breath sounds and feeling for air movement on your cheek. You should do this for no more than 10 seconds. If you cannot be sure that breathing is normal, continue to the next step. Place the heel of one hand on the centre of the chest. Place your second hand on top and interlink your fingers. Position yourself over the patient with arms straight and elbows locked. Press down 5 to 6 centimetres and release fully. Aim for 100 compressions per minute. This fits the beat of Staying Alive and Poker Face. If you feel comfortable and there is no blood or vomit around their mouth, include rescue breaths in your CPR. Give 2 breaths after every 30 compressions. Place 2 fingers under the chin and a hand on their forehead. Gently tilt the head back. Breathe in, pinch their nose, form a seal around their mouth and blow in steadily. Watch the chest rise and fall. Take another breath in and deliver a second rescue breath. You should aim to give 2 breaths within 5 seconds. Perform another 30 chest compressions before delivering 2 more rescue breaths. Repeat this until paramedics arrive. If you have a helper, take turns every 2 minutes, swapping after the rescue breaths. The 999 call handler will be able to tell you or your helper where the nearest automatic external defibrillator is. Only if you have a helper, ask them to go and fetch it, if it is safe for them to do so.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel 1 pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. It is safe to touch the patient. Start CPR.
Stop CPR if the patient shows definite signs of life, such as coughing or eye opening. CPR is the most effective way of saving someone's life. It is always better to do something rather than nothing.